Hello everyone. In this video, we will talk about communicating with the public about COVID-19 vaccination. Specifically, we will address two key considerations. Number one, the importance of audience segmentation. And number two, the role culture plays in communicating with different audiences. To properly communicate a message to the public, you must first identify your targeted audience or audiences. That's the group or groups you want to inform and influence. The more you know about your audiences, the better you will be able to craft messages that are relevant, understandable, convincing, and actionable. The process of identifying target audiences is called audience segmentation. This image shows how segmentation is applied to risk communication efforts. The population segments shown here are adapted from a study that examined under-vaccinated groups in Europe. But the findings can be applied to other issues and places. The goal was to identify distinct groups with similar beliefs regarding vaccination. This study did not focus on COVID-19 vaccination, but it is easy to see why different communication approaches may be needed for each group or segment when it comes to encouraging vaccination. Number one, the unconcerned, refers to people who are not worried about the issue. For example, they may be unconcerned about COVID-19 because they think it is another version of the flu. They will need to be educated about how contagious and dangerous the virus is. They will also need to be told how the virus might impact them personally. Number two, the poorly reached, are people who have little access to information. Communicating with the poorly reached often involves providing information that this group lacks. For instance, they may not know where or how to get vaccinated. So, sharing information about programs that provide free rides to vaccination sites might be helpful. Number three, the hesitant, are people who are not sure. Communicating with the hesitant requires messages that target the source of their hesitancy. For instance, it could be someone who is hesitant because of misinformation they saw on social media about the vaccines. They should get information that counters that specific misinformation, ideally from a source they trust. Number four, the active resistors, are people who refuse a new idea or change. This is the most difficult audience to convince to follow public health recommendations. Similar to communicating with the hesitant, you should target the source of their resistance. For example, some business and economic groups are reluctant to wear masks or get vaccinated. The messages to these groups have talked primarily about the health benefits of masks and vaccines. However, that's not this group's primary worry. What they worry about is the economy. So rather than talking about the health benefits of mask use and vaccination, you should focus on the benefits to the economy. The order in which you address these different groups is also important. For example, you should focus your efforts on the third group, the hesitant, before the fourth group, the active resistors. The hesitant are going to be more open to your communications. But these are not the only groups or segments. Others include the concerned, those who consider the threat a high priority and believe they are at risk. Then there are the worried well. They are at little or no risk but believe they are at high risk. Finally, there are the unaware. They do not know about the health threat but are at risk. The same logic also applies to these groups. For all, you need to think about which groups to prioritize over others for messaging. You also need to produce specific messages that appeal to their needs and concerns. This brings us to the second key consideration regarding the role culture plays in how you communicate with different audiences. One way to better understand audience needs and concerns is to consider their culture. Culture is the complex set of values, ideas, and attitudes that shape behavior. These are common characteristics of members of a particular group. It could be a religious group, an institution, a society, or a nation. Different cultural factors can affect communication during a public health response or emergency. These include the language spoken, traditional and religious beliefs, risk perceptions, and trusted sources of information. It also includes traditional family roles and relationships and acceptable forms of communication, among others. Some of these factors, such as cultural response to risk or whom they trust for information, will make one group more or less accepting of your public health messaging. So, the more you know about a particular cultural group, the greater the chance your message will be effective. Also important, cultural groups often develop, identify with, and trust their own leaders and institutions. This includes faith-based organizations and non-governmental organizations. During a public health emergency, you may not have time to get detailed information about a group's culture. So, you should always consult a person from the target population. This may be people you are working with or from the same cultural group. It may be religious leaders, identified community influencers, healthcare workers, teachers, or respected elders. They can help you understand how a particular culture will view an issue. However, cultures are not always unified. So, it may be difficult to find a cultural representative who is accepted by all. Therefore, you should build ties to various ethnic and cultural communities before a public health emergency occurs. If you find yourself in an emergency situation with few known contacts, reach out to respected leaders and find out as much about the affected community as you can. Identify subpopulations, vulnerable or marginalized groups. Find out the differences in language and culture. Use the tips from these videos to prepare yourself for the types of audiences you will encounter. In summary, this video highlighted the importance of targeting your message to specific audiences and the role culture plays in communicating with different audiences. To learn more, please continue to tune into our Communicating about COVID-19 Vaccine Safety Training series.